NCLEX RN Practice 2026 questions to help you prepare smarter and faster. Question 1. Which misunderstanding by the family regarding pneumonia discharge indicates the need for more detailed information? Option A. The patient may resume normal activities as tolerated. Option B. The patient should resume a normal diet. Option C. The patient may discontinue oral antibiotics once symptoms resolve. Option D. The patient should continue use of the incentive spirometer. The correct answer is option C. The patient may discontinue oral antibiotics once symptoms resolve. Patients must complete the entire course of prescribed antibiotics even if they feel better to ensure the infection is fully eradicated and to prevent antibiotic resistance. Question 2. A nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Which action should the nurse take regarding the family's rituals? Option A. Restrict visiting hours to 2 at a time. Option B. Notify visitors that only clear fluids are allowed. Option C. Keep the other bed in the room unassigned to provide privacy. Option D. Contact the physician to report the unusual rituals. The correct answer is option C. Keep the other bed in the room unassigned to provide privacy. Providing the family with privacy allows them to practice cultural rituals and provide support during the end-of-life process, which is a hallmark of culturally competent care. Question 3. The charge nurse is planning assignments. Which is the most appropriate assignment for the float nurse from labor and delivery? Option A. A 1-week postoperative coronary bypass patient. Option B. A suspected myocardial infarction patient on telemetry. Option C. A patient with unstable angina. Option D. A postoperative valve replacement patient in a non-surgical bed. The correct answer is option A. A 1-week postoperative coronary bypass patient. A float nurse should be assigned the most stable and predictable patient. A 1-week post-op patient is generally stable, whereas the others require specialized cardiac monitoring. Question 4. An 8-year-old child's physician has prescribed glucagon for emergency use. What is the purpose of this medication? Option A. Glucagon enhances the effect of insulin. Option B. Glucagon treats hypoglycemia resulting from insulin overdose. Option C. Glucagon treats lipoatrophy from insulin injections. Option D. Glucagon prolongs the effect of insulin. The correct answer is option B. Glucagon treats hypoglycemia resulting from insulin overdose. Glucagon is a hormone that causes the liver to release stored glucose into the bloodstream. It is the standard emergency treatment for severe hypoglycemia. Question 5. An infant with congestive heart failure is receiving diuretic therapy. Which symptom would indicate the dosage may need to be increased? Option A. Sudden weight gain. Option B. Decreased blood pressure. Option C. Slow, shallow breathing. Option D. Bradycardia. The correct answer is option A. Sudden weight gain. In CHF, sudden weight gain indicates fluid retention and worsening heart failure, suggesting that the diuretic dose is insufficient to clear excess fluid. Question 6. A patient taking phenytoin, Dilantin, is experiencing breakthrough seizures. Which serum drug level indicates a subtherapeutic level? Option A. 15 mcg/ml. Option B. 4 mcg/ml. Option C. 10 mcg/ml. Option D. 25 mcg/ml. The correct answer is option B. 4 mcg/ml. The therapeutic range for phenytoin is 10 to 20 mcg/ml. A level of 4 mcg/ml is too low, subtherapeutic, to effectively prevent seizure activity. Question 7. A patient reports taking 3 acetaminophen tablets every 3 hours for a week. Which symptom suggests toxicity? Option A. Tinnitus. Option B. Diarrhea. Option C. Hypertension. Option D. Hepatic damage. The correct answer is option D. Hepatic damage. Acetaminophen is metabolized by the liver. Excessive chronic intake leads to hepatotoxicity, which can result in jaundice, elevated liver enzymes, and liver failure. Question 8. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which nursing action is most important? Option A. Monitor urine output. Option B. Monitor respiratory rate. Option C. Monitor heart rate. Option D. Monitor temperature. The correct answer is option B. Monitor respiratory rate. Opioids like morphine can cause life-threatening respiratory depression. Monitoring the respiratory rate is the highest priority for patient safety. ABCs. Question 9. A patient has severe lower leg pain after a fall in a football game. Which is the appropriate next step in assessment? Option A. Apply heat to the painful area. Option B. Apply an elastic bandage to the leg. Option C. X-ray the leg. Option D. Give pain medication. The correct answer is option C. X-ray the leg. If a fracture is suspected, an X-ray is required to confirm the diagnosis before applying bandages or heat, which could cause further injury or mask symptoms.